Uh, بسم الله الرحمن الرحيم والصلاة والسلام على أشرف الأنبياء والمرسلين سيدنا محمد وعلى آله وصحبه أجمعين. Today, inshallah, we're going to be explaining and giving an introduction about systematic reviews. So, inshallah, after this session, I think you guys will have the capability of actually starting a systematic review. I will be maybe deficient in some stuff that I think are very doable to do on your own. Maybe, for example, asking ChatGPT or whatever, but I think I am capable of giving you some knowledge that once you leave this lecture hall, I think you're 80% ready to start your own research. So just a quick, okay. So just a quick note. I'd rather take questions from the forum. We will be taking questions also from you guys, but I'd rather just take it from the forum. If you have some anonymous question that you don't want your name to be said, you can just scan this code. It's going to be throughout the slides as well on the right-hand side at the bottom. So, okay, so starting off, I want to give an introduction about what is a systematic review. So basically, understanding that systematic review is a very important part of research when it comes to us as students. Research as a whole is very important. So, and one of the most facilitated type of study is systematic reviews. And as you can see here, even though it's very easy and very simple, this is the pyramid of evidence. You can see that systematic reviews, meta-analysis comes on the top of the pyramid. Why is that? Even it's stronger than normal RCTs. Why is that? Because RCTs give you a subjective kind of one result from one study that has been done. However, when you do a systematic review and you analyze the data, I'm not going to be touching upon the meta-analysis part. I'm going to be mainly talking about systematic reviews. Whenever you do that, you're basically combining a lot of RCTs into one study, making it easier because as a physician, your life becomes very busy. You want something that summarizes all your RCTs into one paper, gives you the conclusion that you can give the best treatment for your patient. So this is why, and plus the analysis and all of that makes the systematic review a very strong study. So I'm going to start off with how to choose your topic. I'm going to go all the way to quality assessment of your paper, which is the last part. Writing a manuscript can be a different lecture. However, I'm not going to touch upon writing a manuscript. I'm going to basically discuss the steps that have to be done whenever you are conducting a systematic review. First of all, choosing your topic. Let's say, for example, you're interested in cardiology, you're interested in gastroenterology. For me, for my case, I'm interested in orthopedic. So basically, I'm going to read a lot in orthopedic field. Why is that? Whenever I read more, I'll get exposed to more ideas, opens the space to understanding what is this field deficient in that I can help by doing research. So this is one of the ways that you can find your topic that you want to do your research on. A second way is to subscribe to journals in your specialty of interest. Now, here I'm giving an example of some of the journals that I have subscribed to as a orthopedic enthusiast. You can see here, for example, these are the main journals that are mainly focusing on orthopedic surgery. So basically what I'm going to do is put my email in these journals, and I'm going to get notified every week, once at least, about the most recent studies that have been done in the field. So, for example, this is an example. Once I put my email, this is something, it's going to be look something like this. As you can see here, I'm getting notified that there is some studies are getting published into that field. Once I open one of these emails, as you can see here, it gives me a summary about the recent studies that have been done in the past week about orthopedic. How I'm going to utilize this study, let's say it's a primary study. Now, it's important to know the difference between a primary study and a secondary study. Primary study means I'm getting the data, I'm getting everything out of this research. I have my own participants, I have my own team of getting the data. Now, a secondary study is basically systematic review, meta-analysis is a secondary type of study because my results are coming from a primary study. So as you can see here, let's say for example, I'm choosing this topic. Now I'm going to take this topic and I'm going to dig deep more into that topic to reach to a level of getting a systematic review meta-analysis. I think this is one of the best ways that you can get your topic, because I know choosing a topic is one of the most difficult tasks, especially starting off your review. And I think this way is going to ease your this step. Okay, now I chose my topic. Now, how can I know the topic is good enough to conducting a systematic review? Basically, I'm going to do something called piloting. Piloting is basically getting to know that your study is good, that the topic that you chose is good, and I'm not gonna waste time working on this paper. For the end, I'll send it to a journal and they're going to decline my paper. So to prevent all of the hard work at the end, so the journal says your paper is rejected, I'm going to do this step, which is piloting my topic. Okay, I get my topic, and first of all, I'm going to create a search strategy. What does a search strategy mean? For example, I have given one topic. First of all, to do a research, to do a search strategy. Basically, what is a search strategy? It is basically a way that I'm going, or like a sentence that I'm going to give, for example, to PubMed, and then from that sentence, I'm going to get all the relevant results or all the relevant research that I can include in my paper to review them. And to do that, I need to get to know these operators, Boolean operators. I need to know how to use them. There is several, but the main that people usually use are and basically whenever you want to use a term that is used interchange, actually like, and I want this, and I want this. I want both of these sentences or both of these words to be in my topic. Or is, for example, when I want either of them, not if I want to exclude some things. Now I'll get to an example, and I think Abdelraouf is going to explain a very detailed example as we finish explaining the concepts. This is an example topic. One of the topics that I was working on is the effectiveness of minimally invasive versus open surgery for lumbar spinal stenosis in adults. Now you can see here, this is the topic. How can I get all the studies that talk about this paper? Because sometimes one author is going to use different terms. So how can I prevent and make sure that I'm including all the papers in my study to make a very strong systematic review, making sure I'm not missing any study? I'm going to use doing a search string. For example, one paper is going to use lumbar stenosis. Another paper is going to use lumbar spinal stenosis. Another paper is going to use degenerative lumbar stenosis. So I'm making sure that I'm including all the papers that use this term, this term, this term, or this term. Okay? And I've explained that I want this search term as well. For example, minimally invasive surgery. Some papers are going to use the short term, which is MIS. Some papers are going to use tubular retraction. It's a type of minimally invasive surgery. And micro endoscopic decompression. Some papers are going to use that. For example, when it comes to, for example, open surgery or open decompression or laminectomy. So all of these terms mean the same thing, but some author is going to use that, other author is going to use that. And when I'm using and making sure that my topic is covered by the search string. Now, one is going to say, how can I know what are the interchangeable terms so I can use them and create my search strategy? Can we take the questions as we move forward? Okay. So how do I know similar terms? How do I know similar terms? Basically, you're going to get one topic and you're going to keep reading all the papers. Read all the papers. Get to know what is the interchangeable terms. This is the only way you can make sure that you're covering all the terms that are needed in your topic. This is the only way. You have to keep trying, because the longer your search string, the more specific your search string, the more specific the results are you going to get, the more authentic your paper is going to be, the more chances that it's going to get accepted in a big journal. Okay. So now I have created my search strategy. Okay, we can take some questions. We'll start with the form, just to make sure that you guys are, just to prioritize the form. Okay, so okay, no one used the response. We can take questions from the audience. Yes, go ahead. Who has a question? Yeah, go ahead. And oh, yeah, sure. Yeah.
So you are looking for researches that have both open versus closed surgery, or are you looking for researches that have open and other researches that have?
No, I'm looking for papers that having both, because my target of my topic is I am comparing two things. I'm comparing minimally invasive spine surgery and I'm comparing open surgery. These are two types of things, because at the end I want to compare the outcomes, because at the end I want to make sure that I'm giving the best care for my patient. This is the basically I want to make sure that papers have both, because at the end, if I want to move to analysis, it's going to be hard to analyze papers that only have open surgery, papers that only have um, like minimally invasive surgery. So I want papers that include both. Okay. Any other question? Okay, no questions. We can move forward. Okay. So now I have created my search strategy. Now I'm going to make sure that, let's say, for example, you have finished your study and now you are surprised that, and it actually happened before, and it does happen many times. But for example, you have finished your whole paper, you've wrote the manuscript, and then you suddenly found out that someone published this paper. Okay, so to prevent that or decrease the percentage of doing that, because for example, if there was a published paper about your topic, chances of it getting accepted in a good journal is going to be very low. So to prevent that, just you take like kind of a prophylaxis. What you're going to do is you're going to search about your topic and make sure that there is no systematic review meta-analysis that was done on your topic. How are you going to do that? First thing, most simplest way, using PubMed. Put your search strategy into PubMed, and at the end, you can write and systematic review or meta-analysis. Now, my search strategy is everything I want plus systematic review meta-analysis. Does that make sense? Okay. This is PubMed for the published papers. If I have an unpublished paper, which can be possible, I'm going to use Prospero. So Prospero is basically the place where you register your paper before starting the paper. Sometimes someone is going to register their paper before publishing the paper. So you're going to look within your topic, use the same search strategy that you have used, but no need to use systematic review meta-analysis, because this website is only for systematic review meta-analysis. You're going to use the same search strategy and you are going to pull it into the search bar, and then it will give you all the papers that are registered, whether published or unpublished. Now you are decreasing your chances of actually getting surprised that later on there is a systematic review meta-analysis done on your topic. Can a systematic review meta-analysis be published before my before I publish my own paper? Yeah, it's very possible. And then you're gonna have to do like some modification to your paper, maybe send it to a different journal. So, but really, this is the most effective way to really increase the chances of publishing your paper. Okay, let's say I have done this step. I found no systematic review. Okay, you can move on forward and do your paper as normally. Okay, now I have one, let's say, disadvantage. I found a systematic review meta-analysis done on my topic. What do I do now? So, has this, okay, what do I do now? You're going to go to this recent systematic review meta-analysis done on your topic. Let's say, for example, you're conducting this research on 2026. See the date that this paper was published in. For example, probably the most recent systematic review meta-analysis done on your topic, most recent one has been done in 2020, for example, published in 2020. So I'm going to go into this paper, look at the papers they included in their study. The most recent paper that was included in their study is 2019. And as you're doing your research, you found out that there is 5 extra studies that has been done on the topic. 5 extra primary studies that has been done on your topic. That means your study is now eligible because it's going to be the most updated. And now you are going to be able to conduct your study. This is one of the ways. Even if the paper was done in 2022, 2023, 2025, but you found out that after this paper, there was 5 extra studies that has been done. Usually I put myself a margin of 5 studies. Some people put 4. For me to stay in the safe margin, I put 5 extra primary studies that has been done. Making this all systematic review meta-analysis not eligible or not updated. It's just like the guidelines. You always update the guidelines. Systematic review has to always be updated. If I'm having 5 extra studies, which I'm putting for myself, this is like, it's not like a clear-cut rule. Some people say 4 is fine. Some people say 3 is fine. Some people no, say I want 6. For me, I usually go with the 5, and I've seen it works most of the time. You can conduct your study. So I want to make sure that this step, like, I know I said a lot of numbers. Does that make sense? How can, if there was a previous systematic review, how can I like prevent it? Make sense? Okay. Now I have made sure that there is no systematic review meta-analysis done. Now my topic is eligible for the next step, which is, do I have enough primary studies? I found a very novel topic, and it's very amazing, and it's so nice, but is it eligible for to actually do systematic review meta-analysis? This thing actually happened to me as well. It was so nice. It's a very novel topic, but then when I conducted to see if there is any primary studies that have been done, I found only 3. So can I really do 3 like systematic review on 3 papers meta-analysis? I have seen people that have done this, but really you're not really doing anything. 3 papers is really like a small number of papers to do systematic review, and it gives you a problem when you want to do the analysis part, because there is not much of results that you're having. Just let me finish this. Yeah. Yeah, this is a good addition, Ahmed. Thank you. So basically, yeah, you can just base sometimes you can base your papers on the number of patients. Like, for example, if I have 3 studies, 1,000 patients, like 1,000 patients, 800 patients, 1,000 patients, it's a big number of patients. So yeah, then maybe you can do a systematic review meta-analysis on this. But again, you have to really dig deep and ask your mentor. Okay. Okay, you have done all of this. Now we are, okay, yeah, how to get your primary studies. To get your primary studies, these are the main websites that I use for my papers: PubMed, Scopus, EMBase, Web of Science. These are the main platforms that I use to search for primary studies. For the people that just came, primary study means RCTs, cohort, prospective, retrospective. Secondary studies mean reviews, basically. Case reports are primary study. Whenever I have the data and I'm doing the data, this is a primary study. Whenever I am getting the data from a different type of study, this is a secondary study. Okay. Okay. So this is another thing that a lot of people don't know about, is that our university is providing access to many of these platforms. So really, you have to utilize the library access, the access that our university is giving us. Go onto the university library website, and then search in the website they have. They are giving us access to a lot of stuff actually that we are not aware of. For example, from these, our university is giving us Scopus EMBase, not Web of Science, PubMed. To overcome this issue, that, for example, if you want to have a platform that our university doesn't have, is to have a diversity of authors. For example, what I do is I usually work with people in the US, or just like, if you want to be simple, you can go with people in MBRU, or for example, UAE University. Usually they have, like, if you have friends there, You can just work with them on the paper. They have a little bit more access than us to these platforms. You can actually utilize them. So you guys are actually helping each other. This is what I do if I'm having some problem whenever I need access to one of the websites. So the more websites you're having, the more authentic your results are, because not all the papers are going to be on PubMed. Some of them are going to be on Scopus. So just to make sure that you are covering, like at the end, you want to make sure that you're having all the paper just to make the to make your paper as authentic as possible. Okay. Last thing, you have done all of these. You have created a search strategy. You made sure that there is no systematic review meta-analysis done on your topic. You're having enough primary study. Okay, I'm happy. Now what do I do? Please get a mentor. A lot of people think that they know a lot of systematic reviews. They are experts in systematic reviews, and they say, I don't need a mentor. You're really not that guy. Just get a mentor who's specialized into that field. For example, if I want to do orthopedic, I'd rather look for an orthopedic surgeon to help me, even if he's not going to have an input into the writing the manuscript, or like, for example, uh, filling the or doing the screening or whatever. He's going to have an input in the information that's going to be given. So please have a mentor or a supervisor just to tell you that you're doing everything correctly. Other than that, having a mentor, this mentor probably, maybe because if he's working on research, he probably has some friends in like a journal you want to submit at, or an let's say, for example, editorial in that journal. He can speed up the process of actually publishing your paper. So that's why always have a mentor. Please don't move a study without a mentor. Okay, to have a mentor is basically you have to send to that mentor your proposal, tell him I want to do a research, and you're going to basically write in this research this it's going to compose your proposal. For example, I want to have a paper. Okay, I'm going to the doctor, I have a paper. Okay, send me what is the criteria of your paper, what do you want to include, all of that. So basically a good proposal should have all of this, the title of the study, obviously. And then we have something called the PICO criteria. I'm not sure if any one of you guys are familiar with the PICO criteria. So basically, P stands for patients or the population that I am targeting. I is for the intervention, what kind of intervention I am applying to these patients. C is not always there, usually a comparator. For example, I have given a previous example of one of the papers that I have done, minimally invasive versus open surgery. So I can put my intervention as minimally invasive spine surgery, and comparator can be open surgery. Comparator is usually not always applicable. It's fine. You can just leave it. Outcome is the most important part. Is basically what are you going to get from that paper. For example, usually in orthopedic, they really like the pain scales and the range of motion and all of that. Usually these are the outcomes in orthopedic papers. Okay, so, and then I'm going to put to him that there is no systematic review meta-analysis done. I'm going to tell him that there is no papers that have been done. If there was, just tell him that it is an outdated paper. And I told you how to get to know that it is an outdated review. And then I'm going to give him the primary studies or the papers that I'm going to probably be using in my review. Okay, whenever, by the way, primary studies, like let's say, for example, you got 6, that doesn't mean you're gonna just work on 6 reviews, because there is a big process of screening, and then you're probably gonna end up with more. Just are like you're drafting your paper. Okay. Okay, we are done with all of this. We can take questions now. If anything is not clear, no one is using for. Okay, how to know that your paper is outdated? Okay. So to know if your paper is outdated or no, basically you're going to see that there is a systematic review meta-analysis done on the topic. Okay, then you're going to go into that study, see the article, check the papers that they have included in their study, in their review. For example, let's say they included last paper was their most recent paper they included was 2019. After 2019, there was 5 papers, primary studies that were published. Okay, meaning their paper is now outdated. There is new data about this topic. You can take the papers they included in their study. Let's say, for example, they got 10 papers. You're going to take their papers and you're going to take the 5 new studies they missed, or weren't able to get it, and now you have a primary updated systematic review. Make sense? Yeah, go ahead.
In terms of the amount of papers that are nice to have to in order to establish a systematic review, would you recommend a specific number of papers that are here as primary research?
Now, you've already heard your colleague Ahmed. He said that he conducted and published a paper on 3 papers, but then he had very big number of patients. Okay, so you can do that. It's really very subjective thing. It depends on the paper that you're working on. Usually, depend on the number of patients. Usually start with the number of patients, then you can move on to the number of papers that you're having. Does that answer the question?
Yes. And
Yeah.
one more question regarding finding a mentor.
Yeah.
How would you recommend what thing would you recommend us to what is a good strategy to find a mentor?
Emails, literally, like just spam emails. Literally, this is the only way. Go on LinkedIn. This is what I do. Just I send massive emails. I remember for that one paper, I couldn't find a mentor. I think I sent like over 50 emails. So it's fine. Sometimes you're gonna get rejected. Sometimes you're gonna say, I'm not fine with it. I don't have research experience. I would prefer to get someone who has research experience as well. But really, emails is the most. Sometimes, sometimes people do is conferences and connecting with doctors there at conferences. That's one other thing. And for example, if you're a clinical student, you can just go to the doctors that you're working with in the hospital. This is one. There's a lot of ways, but one of the main ways that worked for me, because usually I'm looking for people in the US, is emails.
And do they need to have systematic reviews already, or is it
Preferably have some kind of experience so they can help you in the process. Okay. Yeah, go ahead. No, usually, no, it doesn't. Why do you want to study design? Usually in my study, in the design of the study design, usually they don't include case reports, for example, or
So, actually written in the inclusion or the exclusion criteria later on. So even if it's not in the question, we're going to include, and in the practice later we're going to see that study design may be excluded from the research just because of the study design, but not necessarily in the question.
Yeah, I don't put it in my pick a question whenever I send it to doctor. Usually I exclude all case reports, because case report is usually one patient, like few patients. Sometimes I put case series depending on the number of patients, how many patients that. But usually I exclude all like case reports, case series. Okay, I think we have 2 questions here. What's a good range number of articles are preferred? I think I already answered that. Okay, to know if no one has done your topic before, can you just copy paste title? One method on to know if no one has done your topic before, can you just copy paste your title or do the okay, I really didn't understand the question, but I think
They meant to use search for the exact
yeah, use the same string. Yeah, use the same string. Same string.
Same string.
Not the title. You don't use the title, you use the same string. For primary studies and looking for systematic review, you use the same string. Yeah. Once you establish one string, it's enough. Yeah, tell me. Yeah, you are excluding papers, but usually when I do the draft of the primary study, usually it's like the first few hundred results. I'm going to put it just like a draft. I'm just making sure that I'm having enough studies. Whenever I'm moving to the actual screening and all of that, I might actually get more studies. Like for example, something I missed. Because for example, when I'm doing my proposal, it's usually only PubMed. But when I'm going for the screening, starting the actual process of getting to know what are the included papers in my study, I'm having a range of scope of websites. Now, it's not just PubMed, it's Scopus, it's EMBase, it's Web of Science. Usually these are the platforms I'm using. So there is a chance I'm having more primary studies than what I initially started with. Yeah. Other questions? Okay, I think we can move on. Okay, you have done everything. Now your paper is established. Now you have a mentor. Now I'm going to start with my paper. Okay. First thing, whenever you have a paper or for a review, I'm going to start by screening. Okay. Screening is basic. It's three parts. Starting off with the title abstract, you get basically you get more detailed as you move on. First, you start with the title abstract screening, then you go for the full text, then you go for reference screening. Not everyone does reference screening. I do it personally because it has helped me a lot. I'll explain what is it. Usually, it is done by three authors, okay, and two of the authors are blinded. What does blinded means? They don't know the results of each other. Okay, and then one at the end, once they finish screening, is going to resolve the conflict between both of them. So starting off with the title abstract. Okay, so first thing is, for example, me and Muhammad are going to be the screeners of the study. I'm going to have, for example, I have from my results, I yielded like 1,000 papers. Okay, I'm going to screen 1,000 papers. He's going to screen the exact 1,000 papers. Okay, now it can really differ. Like sometimes they'll have four authors screening, for example, 500, 500, 500, 500, different 500s. Okay, he's going to say yes, no, depending only on the title and the abstract. Only on the title and the abstract. I'm going to say yes or no, or maybe depending only on the title abstract. Sometimes it's going to be very easy exclusion. For example, animal studies, study that looks so off of the topic, so irrelevant. Okay. So basically, your decision is going to be mainly on the title and the abstract. I have done this. Now I have, let's say, for example, after the title abstract, now we remove the blind from the screeners and we have the extra person to resolve the conflicts. Let's say, for example, I said yes, he said no. We're going to see what does the author that does the conflict decides on. Is it a yes or is it a no? Now I have, for example, let's say 20 papers. I finished title abstract screening. Now I have 20 papers. I'm going to repeat this process again, but now it is full text. I have to open each and every article, making sure that this article has my inclusion and exclusion criteria. Sometimes you're going to go into this paper. For example, if I'm targeting adults, they won't mention in the paper that they're targeting adults. What they're going to do is going to include it in their exclusion criteria. For example, we excluded all the patients above 18 years old. So it's now a pediatric study and I'm targeting adult study. This is usually you're not going to find in the title abstract. Okay. I finished the title abstract from 20. Now I have 10. 10 are like, let's say 12. 12 are the 100% paper I'm going to include in my study. What do I do with these 12 papers is I'm going to screen the references. Why do I do that step? Usually papers that are in a specific type of title, they're going to reference papers that are relevant to them. So for example, if I have missed a paper that's in my study, I can find it in the references. It's very rare that you're going to miss out a study, but usually it does happen. So understanding that this paper, relevant study, is referencing another study, I'm getting a new paper. So you can say that I have found this study through reference screening. Does that make sense? This is one of the things that can happen, like 1,000 articles, and then at the end you come up with like 6 papers. It's very, very possible. They can start with that. Okay, these are the main screen tools. I'm not aware of any other screening tools. I have used Ryan and currently more confident and happy and comfortable with Confidence. Our university doesn't provide Confidence access. Ryan is for free. Basically, these tools are just to facilitate screening process. They know that you're doing blinded, so they're not going to show the results. They give you an option, yes, no, maybe, and it's very easy. I usually now I'm doing it at the clinic, for example. The Ryan has an app. This is what I like about Ryan. It has an app. You can literally exclude, include on your phone, depending on the title and the abstract. So they're easy. You just have to navigate through the website. It can be difficult at first, but again, it's easy after some time. Okay. Now you're done with the screening. Now you have 12 papers. You're done. You want to do like some kind of data extraction. Does till now, does the screening make sense? Because it's a very important part. Okay, I just want to check the form, making sure that there is no questions. Okay, there's no questions. Okay, here you go. Yeah, this is what Ryan does and Confidence does. Yeah, you just basically PubMed and all of these websites, they have like a way that they are going to give you the possibility to have like a kind of a link or something that you can get all the results that they gave you, and then this file you can paste it into Ryan or Confidence, and it's going to give you the studies. Like it's a file. Basically, for example, if you go to PubMed and then you have like, for example, 1,000 results or 800 results, there is a button. I forgot where is it, but I'm sure you can navigate and find it. It makes a file. This file you can import it to Ryan or Confidence, and it's going to like give you all the uh like just arrange them all in one place. Okay. Yeah.
There's no limit.
Can I have done like 5,000 papers. It's you're gonna have to work on it. Yeah, Abdelraouf.
Yeah, there's no unlimited remote studies. Some semantic reviews you can see up to 1,000 papers you can read in full text. Yeah, that's
Okay, so you're gonna have to work with your way through it.
because I'm someone who that's adding vision criteria. Like for example, you have like 40 papers there, and then you like add that vision criteria like for the language. So already on the English speakers, articles, each of them are excluded.
I think, to be honest, to like come up with 40 papers like for the end, are you speaking about screening or like end results after full text?
It has to be, there's a lot of things on the same topic. Maybe it's a very general topic or not specified as a said. Maybe that's why we got 40.
Because ending up with 40 studies is a lot. You're gonna do data extra, which I'm going to explain. It's a very hard part. Data extraction for
So he like did more exclusion, so he ended up with this.
okay, 20 is fine, but 40 is a lot. You're gonna need more authors. Like for me, 10 studies would take like 4 hours. It's too much. It's too much. Yeah, 40 is a lot. Okay. So now I have 12 papers. Now I'm done with my study. Now I'm going to extract the outcomes from these papers. I have already set my outcomes. How do I set my outcomes? Is that first of all, you have to read and understand all of each and every paper, the 12 paper, really understand what are they discussing, what is their outcome. Usually what I do is I just have a quick look on their tables, because usually the tables are the ones that include their parameters that they're testing. Okay, as you can say, you know your important parameters and outcomes, depending on your paper, depending on what you're working with, you're gonna do your parameters. For example, they have a pain scale, quality assessment scale, but don't like really find a outcome that's common between all the papers. Usually, if you work on a paper that has the similar studies, usually they have a similar outcome as well. Okay, and then you're going to create an Excel sheet. You have all the outcomes for all the studies on the side. Start extracting all the data. Okay, and then, as I said, you start extracting the data. Does extracting data make sense?
We don't have a fact.
I can. I'm just going to stop sharing a little bit. I can show you something. This is one of the. This is one of the studies I'm currently working on. You can see this is how I'm putting all the studies here. You can see the parameter is up. Look at the parameter. Look how excluding all the data. Does that make sense? Look, here is my parameters. They're up. Okay, just a second. What is happening? Okay, see, I'm extracting all the data here. I think it's easy. Like you can do it, right? Does it make sense? It takes time to do it. Like initially doing the template and then sending it to the authors. You can separate. For example, if it's 12 papers, each author can have like 3 papers, for example, to do it. Okay. Sure. Again. Any questions? Yeah. It's not a extraction tool.
Yeah, they have there is a video also in the practice. يعني Providence has a tool too. I haven't used it myself, but it looks nice. يعني I'm going to show a video of it.
It does an Excel sheet.
It's similar to an Excel sheet. It has a 2-view window, so you put an article on the right, left, or on the data. You can start pulling the data up to like a table on the right.
Oh, I have never used it. I'm on the old way using the Excel sheet. Yeah.
Also, the practice window happens on the Excel sheet.
Okay. Okay, so the last step after you have done your data and everything, you have to do quality assessment. What does quality assessment mean? Quality assessment mean is that you are making sure that every paper you included is credible. It has a good quality. If you're going to do, some people do systematic review without quality assessment. Systematic review alone is weak. Having losing an extra component, which is quality assessment, makes it weaker. Because usually what some people do is do systematic review and on one paper and publish systematic review alone. And then on another paper, they publish the meta-analysis. I don't suggest that at all because the credibility of your systematic review becomes weak. Have systematic review and meta-analysis on one paper, so it becomes a strong paper. So, but you can publish systematic review alone. It's fine. But at least do the quality assessment part. Quality assessment is basically you take a paper and then from this paper, okay, so depending on the paper that you have included, depending on the design of the paper, for example, if I have RCT, I'm going to use this check. It's basically a checklist. You're going to use that checklist, yes, no, and then it gives you a grade at the end about this paper. For example, if I'm having diagnostic test accuracy studies is usually not really used. Observational studies, I'm going to use Newcastle Ottawa scale. And then you can see this is the scales that I'm using. This is an example. Just let me take you to the checklist. It's basically like a checklist. You're going to open the paper. It's asking you a few questions, yes, no, unclear. And usually with each checklist, it actually explains the question. For example, if I'm looking at this question, I'm not understanding what they really need. They have an explanation probably at the end of the PDF that explains what this question aim for. After that, you're gonna have a grade for each paper, and then you just can do a table for that and then paste it. Okay.
Our last step was the quality assessment, which is step number 5. What was the first 4 steps? Choosing the topic is the first one. طيب, just to refresh يعني. Choosing the topic is the first one. The second step is piloting your study. During the pilot, you will create the PICO questions, which is basically I'm just reviewing so that when we go to the practice, we're going to go over them in the practice. طيب, after making your PICO, what's the next step? Or after piloting? The real work, screening, and after screening, extraction. And finally, the quality assessment. طيب. The objective of this practice is first to show you that it does not need a large or a big level of knowledge to know how to do a systematic review. Even if the topic seems difficult, complex, whatever, you can do a systematic review. And hopefully after this practice, you will feel, you will feel more confident about doing it. طيب. Example. طبعا making the research question, which is part of the piloting, as we said, can be done in two forms. By far, the most common is PICO for intervention review. POPCOC is used for prevalence review, which is another form of creating a question. Quickly, how do we form a PICO question? Does anyone have any idea? When do we form PICO question?
Basically includes the criteria which are required for the study to be included in the research.
Very, very good, very good, very good. Right. That's basically what is PICO. PICO is like a labeling of the type of studies that you are going to have. Forming, yeah. Definitely. So PICO is for comparative data. Intervention means that you will have two groups. One will receive an intervention and the other will receive the comparison, which could be a placebo, like in randomized controlled studies, or other medications. Okay. Type. When do we form a PICO question? Basically, in the clinical practice, every 3 patients, you will get 2 questions. Meaning, so let's say a patient came to the clinic, he has eczema, and asks you, if I eat probiotics, will this help my eczema? Do you know the answer for that? Sorry. Do you know the answer for that? Even if you know the answer for that specific question, you're probably going to be asked some questions that you don't know the answer for. So if that patient is, let's say, a 14-year-old, what you're going to do is to look at studies talking about this question, is that you're going to formulate a PICO question. Basically, you will formulate eczema is that the population will be pediatrics, intervention will be what? Probiotics. What's the comparison? Could be placebo, could be no comparison, whatever. What's the outcome? Exactly. So either when you're looking at outcomes, either if he's complaining of itchiness, so you'll see the effect of probiotics on itchiness, on pain, on flares, whatever. Okay. So this is basically what is the PICO question for. Yeah. Right. In our example, so in my experience here, and I will share my experience in doing systematic reviews. My experience is that I was recruited in a team. This team had already chosen the topic and had already gathered the studies. Our duty as students involved in this research is only to do screening and extraction, okay, which is our practice here. So what we received is this. These are 7 PICO questions. If I read the first one, in pediatric patients with lymphoblastic leukemia/lymphoma, should primary anticoagulant prophylaxis be given compared to no prophylaxis? Seems very complex, right? We will see that no matter how complex it is, you're just going to look for the PICO, population, intervention, comparison, outcome, and you're going to do everything just as Khaled mentioned. You're going to do screening, first title and abstract, then full text, screening, and finally the data extraction. In this case, we had, of course, a lot of PICOs. They were about 10. In the practice, we're only going to focus on the first one. Okay, so keep it in mind. What's the first PICO?
Population is pediatric patient.
Nice. Okay, so that's the population. Who can give me the intervention? Anticoagulant prophylaxis, very important, because some studies may include anticoagulant as a treatment. That's excluded. We need anticoagulant prophylaxis. What's the comparison? No prophylaxis, right? And the outcomes are going to be discussed in the next question. So, as you mentioned, this is the population, this is the intervention, comparison is no prophylaxis. Outcomes also in that case was determined by the research team. They had these outcomes. So VTE, whether symptomatic or asymptomatic, major bleeding, clinically relevant non-major bleeding, bleeding unspecified, whatever the outcomes. And Khaled mentioned how if you are going to do your own systematic review, how you're going to look for your own outcomes. In that case, the outcomes were provided by the team, or if you're working with a doctor, he might provide you with the outcomes and so on. Right. Also, you will be provided by inclusion and exclusion criteria. Type inclusion criteria, طبعا, if the population is pediatrics, anyone above 18, below 18 is included. Studies examining prophylactic and not treatment like anticoagulant. It has to be on the PCOS that are on the previous slide, and involving chemical anticoagulant. So if there is like surgical embolectomy, not included, or it could be physical anticoagulant, that's also not included. So exclusion, by definition, adult only population. Anticoagulant used for treatment, basically the opposite. Okay. طيب. We're going to make a two-window view. We are going for that example, which you'll see that looks very complex. We'll see that it will be a very simple process to do screening for studies. طيب. First of all, I need a volunteer. So I will pull up a study, and the volunteer will tell me if this study is included or excluded. Okay, 1, 2, another one. That area. Okay, 3. طيب. طيب. ايه
هذا شيء اسمه الشغله.
عادي خليه مش مشكلة. طب قصدك للريكوردينج.
ايوه
It's fine.
خلاص.
It's fine. طيب. It's okay, it's okay. طيب, in our screening, we have 2 types of screening, or 3. What's the first screening? Title and abstract. So you're going only to read the title and abstract, and based on that, you're going to include or exclude. طيب. Let's say if you don't know, will you include it or not? You actually are going to include it. So the maybe option in the confidence will send this article directly to full text screening. Yeah. So if you're not sure, include it. And when you do full text, you're going to read the full text. And if there is something in the exclusion criteria in the full text, you're going to exclude it. But the title and abstract screening is meant to be a sensitive tool. So you're going to include all that you need. And if other articles were included as well, that's fine. In the full text, that's going to be specific. So you will only keep those who are relevant to your questions. Is that a clear point? Okay. طيب يلا أنت you'll read the title. Okay. Okay. طيب. Based on the title, are you going to include or exclude? Is it a part of the exclusion criteria? Okay. Is it in the exclusion? No. It's not. It's not. So in the title and abstract, if there is no exclusion, reason for exclusion, include. Even if later on in the full text you will find something that makes it not relevant to you, you will exclude it later. But based on the title, if there is no reason to exclude, include it. Okay. Type. So who agrees with him that it should be included? Raise your hand. Agree? Okay. Anyone disagrees? Sure. So this study is to be included. Okay. So even without, ideally you will read the abstract as well. So it's called title and abstract. طيب. But for to save time, this is included. Okay. طيب. I will open another one. Yeah. Of course. As I told you here, this is what my experience was. We used to work with a team with a large team, so they had 10 PICOs. In the screening, we used to screen 9,000 or 10,000 articles. For the full text, sometimes 1,000 article or 900. Yeah. Of course, for the extraction will be much lower, maybe 200, maybe 100. Yeah, of course. Yeah, it can be one PICO. Yeah. Yeah. Of course, if you are doing the study yourself, it's better always to work on a smaller scale. Yeah. But as I said, the objective of this whole meeting is also to share the experiences of other students. So some of you might work in a big group or a big team. So just so that of all options. Yes.
Not of the question really. It's not really related to this. It's regarding the original presentation.
See.
Of similar for.
Yeah. No. Ask it.
That's fine. Regarding the quality assurance. So to make sure, supposing we find a study that has a pretty low Chromebook score, for example, program score. Is there a cutoff point we usually use to include or not include the study? Especially nowadays, right? There are a lot of studies which are primary studies, but not very high quality in the literature. So
depends on the scale and what does the scale say, because there is instruction for. Depends on the scale and what the scale says, and there is instruction for each scale. If the study has a very low score, usually we exclude it because it's going to affect the results or do bias in the results.
Yeah. It's a screening. It's a third.
Because later on, when you want to do the analysis, if you have a very low quality paper, it's going to be some bias in that.
Our second volunteer. Here is your PICO. Inclusion, same PICO. This is the article. I want you to read the article. Okay. Okay, sure. So the title is Efficacy and Safety of Extended Duration to Perioperative Thromboprophylaxis with Low Molecular Weight Heparin on Disease-Free Survival After Surgical Resection of Colorectal Cancer, Multi-Center Open-Label Randomized Controlled Trial. Excluded. What's the reason? Definitely. Okay, that's a good question. Okay, so if the study is talking about colorectal cancer and our population is pediatrics with leukemia or lymphoblastic leukemia, so this does not fit into this PICO. So this article is excluded from the title. Okay, you see. So you may finish screening 100 titles in less than an hour. Sometimes only by reading the title you're going to know it's excluded. طيب. Just to make it more difficult, do you think it fits into other PICOs? Because when you're working with multiple PICOs, you're not going to scan or to screen the articles on one PICO. You're basically going to have 100 articles. You're going to know what each article, does it fit into any of the PICOs? And if it does not fit into any of the PICOs, then it will be excluded.
Assuming all the PICOs have pediatrics, I doubt colorectal cancer comes that much in pediatrics.
That's a good point. I'll talk about the age. But does it specifically say it's for adults only?
No, but I'm thinking about colorectal cancer.
Yeah. So in this, we never assume, as Khaled mentioned, we never assume. Yeah. Yes. Yeah. Even later in the extraction, we're going to see that even if they say thromboprophylaxis, you will go and look what's their definition of thromboprophylaxis, because it may be different from your definition. And by your definition, this is not a thromboprophylaxis, and therefore it's excluded. So you never assume, yeah, unless explicitly said. Okay. طيب.
There was good time, there was
Yeah.
then for good time it was which they wrote, but when I went to the methodology, they said only nighttime. They didn't include how many hours
Yes.
the patient's nighttime used. So I didn't assume. Even though the definition of nighttime was correct, but in their methodology, they didn't say the nighttime how many hours the patient swore the brace.
So you would basically reach that in the full text screening.
Yes.
Then
Yes.
you would decline.
100%. 100%. So if the exclusion reason is not obvious in the title or the abstract, you will include, and it will be, if it's not relevant to your PICOs, it will be excluded later on in the full text, or it may be included.
And if you are not sure at all, then you exclude. And if they don't express mention at all in the paper.
Included.
Okay.
What do you mean?
مثلا like the definition of a very important.
You include.
If they don't include the definition, you assume it is.
It's yours, yeah. Yeah. Most high quality articles, they would say we follow the WHO definition, or we follow the American Psychiatry Association definition, or whatever. Yeah. So I don't think that's an issue. Did you get your answer? Is it based on other PICOs? Is it included? 7. Should pediatric patients undergo surgery receiving thromboprophylaxis compared to? So here, okay, it fits into 7 because it's no. So that's no. So that's after the surgical resection, not on. What's 2? It is 2, yeah, because colorectal is, if it's not a leukemia, it will be a solid cancer. Okay, so that's the definition of solid cancer. However, he mentioned a good point, is that what about the age group? So we will go to the abstract and see if they mention the age group.
18.
Yeah. So in the abstract, 2 main paragraphs you're going to look at: the methods section and the results section. Okay, you're going to find all your answers in most of your answers in this book. So here in the methods section, the design is RCT, the setting in 12 hospitals in this duration, participants 614 adults, age above 18. So that is not in our PICOs. All of the PICOs are on pediatric population. طيب, if the study had mixed population, so they included pediatrics and adults, what do you do then? You have 2 options. So it basically depends on your team. In the team that I worked with, they included mixed studies, and later on, they only, during the data extraction, they only took the data from the pediatric population. Yeah. So let's say if they had 100 pediatric and 100 adults, yeah, those 100 pediatric had 70% outcome of VTE. So they included only that arm. They did not include the adult arm. Okay. So mixed populations also included. Yeah. Unless the team does not has enough patients or has enough studies, then they may want you to exclude that article. But it basically depends on the team that you're working with. Yeah. But it can be included. Yeah. It can be included. And during extraction, you will only extract the data that's relevant to your question. طيب. Our third, so this is to be excluded. We only included the first one. طيب. Our third volunteer. Okay. طيب. Sorry, 1 second. I know we're going over the time, but we're almost done. طيب. If a study was included in the title and abstract, where does it go? After title and abstract, what do you do with it? Full text. So we're going to do full text screening with this, and we're going to extract some data that we have. طيب. Third volunteer. طيب. So in the full text, I think it will be difficult. And I thought of sharing the QR code, but it will be difficult. Basically, if you go over the full text, you're just going to go over the methods and results and make sure that this study follows your people. Yeah, so it's relevant to the population, interpretation, comparison, and outcome. Yeah. But I will show you how to do the extraction. Okay, so in extraction, basically this is an Excel sheet. It's an example. It's a simplified example. You may include more than that, but just as an idea, it will look like this, an Excel sheet. You'll start by completing the data that you want. So the study, you're going to take the name of the study, the title, the year, the DOI. After that, you're going to go over the methods. So we'll go table 2. Sorry, guys. طيب, I can't find it, بس طيب, we're going to skip the I can't find the exact data. Basically, the extraction is getting the data from the article itself and filling it into your extraction sheet. طيب. So if in the extraction sheet there they tell you the sample size. You're going to go over the data and the samples. You're going to take the sample size, put it there. So out of this sample size, how many developed a BTE? Yep. You're going to take that number and put it in the extraction sheet. Yeah. The covariables. So like age, did they differentiate between the age? Yes. And they divided the patients into less than 14 and above 14. Yeah. So that all goes to the covariates as well. Yeah. Right. Unfortunately, we could not do the extraction. We're also out of time. But hopefully that was helpful to you. Of course, if you have any questions. Thank you so much.
Thank you.
Final remark. I know I said a lot of information. I think when you go back home, if you want, you can review the recording. If you want, you can ask me questions anytime. Anyone has my number. I think I sent it to the research group. You can see my number there. You can send me any question as well as the.
Of course, of course.
So the idea is that by the end of this lecture, you have the concept, you have the idea. Now it's your part to start applying. That's why I said you're not 100% ready. You are 70 to 80% ready because you have the concept to stay in the play. Just like the medical student that has the information but still didn't apply to the clinic. It's the similar example. First study is going to be very hard. Second is going to get easier. Third is going to get easier.
Of course.
And by the time you end, you have a good amount of studies. I think you can do a review, systematic review. I think if you have a good team, you can finish it in 1 week.
Yes.
That's why I think systematic review is one of the best studies to publish as a medical student. It has a lot of impact, has big impact. You know, one of my colleagues, the systematic review meta-analysis was referenced in a guideline, one of the countries. So I think it does have a big impact, and it's not impossible to really start now. Studies like cross-sectional need a lot of work, like collecting data. I'm not a fan of cross-sectionals at all, the one that we do in CBR, because you have to collect number of responses, do a lot of analysis of systematic review. You can do the whole thing on this. That's why I love systematic review meta-analysis. I think it's a good opportunity if you read a lot of publications.
Right. How many of you feel now confident to do screening for a systematic review? Screening. Okay, that's a success. Right. Basically, this is one step forward. You don't have to know everything about systematic review to start one. You can by how he mentioned, to create a search strategy, choosing the topic, and then start with the screening. If you're done with the screening, then you can go and look what are you going to do next. Yeah. So as long as you have a step in, that's you're one step closer to achieve your goal, which is publications. Yeah.
And then when it comes to resources, I forgot to mention, it's not just for systematic review. I know this is my first research lecture, but when it comes to really learning research, I recommend a course which I took, the course. I've already told many of my colleagues about it. And basically, it teaches everything you need about research from A to Z, whether it's enzyme, RCP. It makes you learn how to do math groups and all of that. It is a paid course. And I think they have an offer if you and your colleagues, like I think 10, go together, they get an offer. It comes instead of $200 and $400. And I think it is very worth it. Let me read. Ahmed Najib. Yeah. Okay. And then there's a free course my colleague have taken. It's in the cocktail book, basically.
Yeah.
I think they have a book. And it explains everything you need about each and every topic. Study is a free resource. However, I highly suggest if you can go for the course. They give you 2 years access. My access is almost done. Very soon. And I still tell this day I refer back to this course. Because sometimes I forget stuff that I'm not always using. For example, quality assessment is one of the things that I don't really use much. I usually like have one of my team do the quality assessment. But then if I forget anything, I just refer back to this course. So yeah.
طيب. One last remark. Can someone tell us what are the 5 steps of doing a systematic review? All 5 steps. No? The first 4. Yalla, we have one. Choosing your topic, that's one. PICO, which is part of the piloting. So the piloting is second step. Quality analysis. Yeah. So now you know what are the 5 main steps. If you face a difficulty in one step, you can go and look into that step and find a solution. Yeah. But as one of the objectives of this session is to let you all have an idea about what are the main steps. Yeah. Thank you so much for attending. Thank you so much. طيب